It became the word of the day. The voices who carried it were researchers, healthcare teams, departments of public health, politicians, and victims. Soon the word was a part of everyone's vocabulary, although the levels of understanding varied greatly. In fact, misunderstanding, doubt, fear, opposition, and arrogance were as common as acceptance, responsibility, and adherence to guidelines. These voices have been the echoes of past voices as we watch history repeat itself. Before public health, before discoveries and treatments, rough journeys and speculations fought for ways to not only heal, but to identify the causes and stop the spread. This is a presentation of a few of those long ago voices that were motivated to make changes. And these are the voices of today expressing what has been unrecorded from millions of victims of the past. These are the voices that bring us to COVID-19.
The voices of the cholera pandemic spoke to the world, from the standpoint of its victims crying out for help to the voices of those looking for the causes and solutions. This pandemic introduced us to Dr. John Snow, who is considered one of the founders of modern epidemiology for his work with cholera in the mid-1800s in England. Cholera is an intestinal disease that causes death within hours from the first symptoms. It still causes nearly 95,000 deaths a year worldwide. Modern sewage and water treatment have helped eradicate cholera in most countries. But in the mid-1800s, people did not have running water or modern toilets in their homes. They used town wells and communal pumps to get the water they needed for drinking, cooking, and washing. Septic systems were primitive, and most homes and businesses just dumped untreated sewage and animal waste directly into the rivers. Dr. Snow believed that water was the source of cholera and not miasma, as was the common theory. Miasma meant foul air, and that certainly described London at that time because it was the largest city in history with over 2 million people. Dr. Snow lived in a section of London called Soho, and he observed that more deaths took place around certain water pumps. He worked around the clock trying to track down information that he needed from hospital and public records. This is the geographical grid that Dr. Snow developed from his research. He charted the deaths by sex, blue for males, pink for females, age, and location. He finally was able to convince the town to shut down the water pump on Broad Street, which is in the center of the main dots. And as you can see on the line graph in the upper right corner, the death rate then dropped to almost zero. But still, his theory was not accepted. Reverend Henry Whitehead also lived in Soho. He was a social advocate, and he wanted to prove Dr. Snow wrong. The two of them went from house to house to gather information like contact tracing of today, asking standard, essential questions. In the process, he too concluded that water was the source. Others finally started listening to this theory when a mother washed her sick baby's diaper in a town well, creating an outbreak with 616 deaths. Reverend Whitehead voiced his admiration of Dr. Snow and shared this comment. "You and I," Dr. Snow would say to me, "may not live to see the day, and my name may be forgotten when it comes, but the time will arrive when great outbreaks of cholera will be things of the past, and it is the knowledge of the way in which the disease is propagated which will cause them to disappear." How appropriate those voices were in the battle against infectious disease. Edwin Chadwick, a London lawyer, is one of the most recognized voices in the sanitary reform movement. He studied the life and health of England and inspired similar studies in the United States. The most famous of these was conducted by Lemuel Shattuck, a Massachusetts bookseller and statistician. He documented differences in morbidity and mortality rates in different localities. He showed that poor living conditions in the city threatened the entire community. Quote, "Even those persons who attempted to maintain clean and decent homes were foiled in their attempts to resist disease if the behavior of others invited the visitation of epidemics, unquote. Through time and other studies, public health agencies were developed to help control and prevent diseases. Like in 1866, the efforts of the New York Board of Health, including inspections, immediate case reporting, complaint investigations, evacuations, and disinfection of possessions and living quarters, kept an outbreak of cholera to a small number. The mildness of this epidemic was no more a stroke of good fortune, observers agreed, but the result of careful planning and hard work by the new health board. These voices of past diseases were not always heard in their time, but often have been the springboard for further development of the theories and sound techniques used today. The work of battling cholera in the 1800s translates directly to the struggle against COVID-19. Then, as now, public health agencies played the lead role in investigating outbreaks, issuing quarantine orders, and educating the public. The lessons learned in fighting cholera have been invaluable to the world community and have saved countless lives since their implementation.
Polio is a virus, and 30% of cases experience symptoms that affect the entire body, initially appearing as flu-like symptoms and quickly involving muscles and nerves. This ancient art shows a member of royalty supporting his withered leg with a walking stick. It's through ancient art and stories that historians believe polio has been around for thousands of years. The virus causing polio was finally identified in 1909, and it is only found in humans. This highly contagious virus was active around the world, easily growing into outbreaks. The virus flourished in temperate summer conditions, and contagion was worse then. The U.S. began having epidemics during the first half of the 20th century, and in 1916, New York City experienced the first large epidemic with over 9,000 cases and a 26% mortality rate. And then the summer of 1952 was an especially tragic time of contagion across the U.S. This sign on top comes from the same era in the U.S., and it shows the involvement of local health boards in an effort to enforce rules curtailing the spread of polio. It wasn't uncommon for a notice to be posted on the front door of an infected person. Since flu-like symptoms were typically a first sign of polio, parents would not allow their children to play with other kids who had colds. While both adults and children could catch the virus, children 5 and under were especially vulnerable, and they represented 50% of polio cases. An atmosphere of terror hung in the air. It was understood that polio could be deadly, and if the sickest patient survived, they were left with some paralysis and handicap in the legs and/or the lungs. Simply, the virus enters the body through the mouth, infecting the pharynx. It moves to the gut, then it spreads through the bloodstream. The virus resides in feces of an infected person, and if a water source is contaminated with this waste, viral spread is quick. Almost 99% of the world population had eradicated the polio virus by the late 70s. Due to the work of Jonas Salk and all-out clinical research, by the mid-20th century, we had a vaccine. Let's look at live footage to get a sense of polio in the lives of people then.
When we look back upon polio today, you look back upon what was really a summer plague. It came every year. It came like locusts. There was no prevention. There was no cure. There was no protection.
I grew up in a family where there was a sense, that my dad was a scientist. He actually would talk about how he used to, as a child, pray that he could do something good for humanity.
He was the miracle worker in the white coat on the one hand, but he was also an incredibly hard-working, devoted scientist for whom people were willing to sacrifice.
He was challenging medical orthodoxy.
All of the people who mattered in virology, John Enders, Albert Sabin, Tom Rivers, and others, basically believed in a live virus vaccine. And here is Jonas Salk, someone who was younger, going in exactly the opposite direction.
He was well aware of the early vaccine failures. The first attempt with an inactivated polio vaccine killed kids.
It's a testament to his courage and resolve that he could inoculate children with something that he knew started out as live, dangerous poliovirus.
The stakes couldn't be higher. Vaccines are always a matter of risk versus reward, and nothing is perfect. Nothing is perfect.
We didn't have to really be stimulated very much because up on the third floor was the polio ward where they had all the iron lungs.
And I remember the faces on some of these kids, in agony. Just picture your own 2-year-old. It's just dreadful.
The vaccination was 80 to 90% effective against paralytic poliomyelitis.
The guy gets off the elevator. He never got into the room. It works, they were yelling.
There were newspaper reporters that ran to telephones to quickly get this as a front page headline on probably every newspaper in this country.
Kids ran out into the street, factory whistles went off, church bells tolled. It was in a way as if a war had ended.
Jonas Salk became a national hero. He was on the cover of Time. Newsweek called him one of the greatest Americans. President Eisenhower invited him to the White House and actually broke down. This is a sign of how great American medicine is at this time. It is an extraordinarily wonderful, optimistic moment, okay? And there is reason to be proud.
Jonas Salk is the people's scientist. Whom do we remember? Sigmund Freud, Albert Einstein, Jonas Salk. It's perfect.
The 1918 influenza pandemic, often referred to as the Spanish flu, ravaged the world from February 1918 to April of 1920. In the past, it was thought that perhaps 20 million people died. In recent years, that figure has been revised upward considerably. It is now thought that between 50 and 100 million died. With the world population of 1.8 billion, it could be that nearly 1 in 20 people died in the entire world during the pandemic. For another comparison, the pandemic killed more people than World War I, World War II, the Korean War, and the Vietnam War combined. Most experts believe the disease started in Haskell County, Kansas. The virus most likely originated from poultry, although some have proposed that the virus may have spread from pigs as an intermediary. In normal times, the initial outbreak would have likely have ran its course locally and then died out. However, in 1918, the world was at war, and Haskell County lay just 300 miles from the military facility Camp Funston, today known as Fort Riley. The military barracks soon had its own outbreak, which proved difficult to contain. On March 4th, 1918, as many as 500 soldiers were hospitalized within a week. The illness seemed to be under control by September of 1918, when 9,000 troops were crammed onto the Leviathan transport ship bound for Europe. The Leviathan was a converted luxury liner meant to hold 6,800 people. The Army, however, had retrofitted the vessel with stacked bunks. The ship's new capacity was 9,000 troops and 2,000 crew. Many troops were already displaying worrying symptoms when they boarded, such as pounding headaches and sore throats. Within 24 hours of leaving port, the virus had infected 700 troops and the sick bay was overflowing. Within a week, the number of infected had climbed to 2,000. An official military report described the dire situation. Pools of blood from severe nasal hemorrhages of many patients were scattered throughout the compartments, and the attendants were powerless to escape tracking through the mess because of the narrow passages between the bunks. There's some speculation about why the virus became so deadly. The virus may have combined with another virus, or it may have just been a very successful and deadly mutation, But when the virus reached Europe, it spread far and wide. What exactly made the virus so deadly in 1918? Unlike modern flu viruses, the virus of 1918 caused severe lung damage. Victims often experienced fluid-filled lungs as well as severe pneumonia and lung tissue inflammation. Influenza vaccines did not yet exist, and neither did antibiotics. Penicillin was not discovered until 1928. No flu antiviral drugs existed. Mechanical ventilation also did not exist. The virus spread rapidly through Europe, often following troop movements. Many nations hid the severity of the disease, since revealing information could have been damaging to their side in the war. Spain, however, was a non-aligned nation and was free to report information in their media. This is how a disease which likely started in Kansas is today often referred to as the Spanish flu. Back in the United States, the virus never completely went away. Virus seemed to dissipate over the summer of 1918, but returned in force after 2 sailors became ill in Boston. Life in much of the country crawled to a standstill in October 1918 as local municipalities shuttered public spaces such as schools, churches, theaters, and saloons. Many communities mandated mask wearing as a means to combat the virus, with San Francisco even charging $5 for violating their mask mandate, a considerable sum at the time. And in these images, you have a Seattle streetcar conductor turning away a maskless commuter. At the bottom, you have an advertisement for a meeting by the Anti-Mask League. This is taken from the San Francisco Chronicle on January 25th, 1919. Philadelphia was among the cities hardest hit after its public health director, Wilmer Cruzen, refused to cancel a parade that was attended by 200,000 people. Over 11,000 Philadelphia residents died in October 1918, including 759 in just one day. Open carts famously circled the streets to collect corpses to be buried in mass graves. And on this image, you can see the Liberty Loan Parade. This is in Philadelphia, Pennsylvania on September 28, 1918. The 1918 pandemic ebbed and flowed and then gradually just fizzled out by 1920. People had either died out or developed immunity by that time. The pandemic had killed 675,000 Americans and left hundreds of thousands of children orphaned. Americans, for the most part, chose to ignore this, to forget this dark period. It fell into this black hole of history, historian Kenneth C. Davis said. Impacted families never seemed to talk much about it because it was so terrible that no one wanted to think about it again. That's the way the country also dealt with it. And here you can see a book also by Kenneth C. Davis. If you're interested, you can read more about it or buy that on Amazon there. And what lessons can be learned from 1918? The pandemic of 1918 offers an extraordinary look at how easily disease can spread, especially in times of war and uncertainty. Although the pandemic is very different from our experience with COVID-19, it is also true that history repeats itself. For example, although municipalities attempted to mandate mask use, there was also widespread resistance to the idea, just as today. Similarly, while troop movements spread the disease in 1918 via transport, ship, and rail, leisure travelers helped spread COVID-19 in 2020 via cruise ship and airline travel. Unfortunately for the people in 1918, there's no possibility for a vaccine, and people had a much more limited understanding of disease and how it spreads.
This brings us to current day. January 30th, 2020, the World Health Organization declared the outbreak of COVID-19 a public health emergency. A short time later, in March of 2020, COVID-19 was declared a pandemic. These are the voices of some who have been affected by the COVID-19 pandemic. Anything good I could say about this would be a lie. She's dead and I'm quarantined. That's how this story ends. I keep going back over it in loops, trying to find a way to sweeten it, but nothing changes the facts. I wasn't there with her at the end. I didn't get to say goodbye. I don't even know where her body is right now, or if the only thing that's left is her ashes. Tony Sizemore on the death of Bertie Shelton. It was me. I know it was me. They keep telling me it's not my fault, and I'd give anything to believe that. The doctor called after my mom went to the hospital and said, "Don't blame yourself. You didn't do anything wrong." The pastor said basically the same thing at her funeral. "Let it go. You had nothing to do with this." Francine Bailey on passing the coronavirus to her mother. Do people understand what's happening here? Do they care? I'm happy they put us at the top of the list, but I doubt it's going to make much of a difference in here. Can I get the vaccine today? Will I have immunity by tomorrow? Because that's the kind of timeline we need in this nursing home. More than half of this place is COVID positive. I'm one of about 80 residents, and 30 got sick this week. Bruce McGillis on the excruciating wait for a vaccine inside a coronavirus-infected nursing home. But what happens if they run out? I've never done anything like this. I don't really know how it works. I've been standing in line for a few hours now, and it's barely starting to move. I'm not complaining. It's a blessing to be here. I'll wait all day if I have to, because this virus has left me with no other choice. But what happens if they run out of food? Johnny Rivero on his first time standing in a food line. Is this another death I'll have to pronounce? I'm always driving, going back and forth between nursing homes, the hospital, and the morgue. All these roads should be empty if you ask me. But now I see people out running errands, pushing back into their lives, and it's like, why? What reason could possibly be good enough? Sometimes I think about stopping and showing them one of the empty body bags I have in the trunk. You might end up here. Is that worth it for a haircut or a hamburger? Michael Fowler, Doherty County Coroner, on the reopening of Georgia. You're basically right next to the nuclear reactor. I could be the last person some of these patients ever see, or the last voice they hear. A lot of people will never come off the ventilator. That's the reality of this virus. I force myself to think about that for a few seconds each time I walk into the ICU to do an intubation. Corey DeBergergrave on performing one of the pandemic's most dangerous jobs. I was lucky to find this vaccine anywhere. I've been so focused on helping to develop these vaccines that I barely thought about the mechanics of getting it myself until this month. How can our process be this complicated? I've been calling around now for the last several weeks. I could not find out where, or when, or how to receive a vaccine. I didn't get anywhere. Stanley Plotkin, legendary vaccinologist on the historic development and the chaotic distribution of COVID-19 vaccines. I needed something good to happen. I was one of the first people to get vaccinated in Kentucky. The whole thing was surreal. It happened in a small auditorium, and the governor gave a speech. I walked on stage and pulled up my sleeve with the cameras rolling. A few people clapped when the needle went in. Some of us were crying. It felt like this amazing victory celebration, and then I went back to check on my patients. Valerie Briones Pryor on ending a year of grief with a moment of hope. Next is a short video linking experiences of past pandemics to our current pandemic today.
When my mother was 15, she was stricken with polio. Doctors told her she would probably not even survive, and if she did, she would never walk again, and she did. It was a pretty amazing story. She had 7 kids. I was the youngest of 7 and the only girl. We grew up hearing her say the phrase, "I need you to be my arms and my legs," and we did. You know, we did all the vacuuming, we did a lot of the house cleaning, and she was amazing and did everything that she could do. She'd make bread, but she couldn't lift the loaves into the oven. She couldn't pull them out. She couldn't knead the dough, things like that, and so we grew up doing a lot of those things. And as she got older, she then dealt with a lot of what they call post-polio syndrome, and was in a wheelchair and on oxygen. And so I had the privilege to have her and my father in our home with my husband and my kids, and was able to take care of her. So when she passed away, I missed being able to help her. So as I started thinking about going back to school and what I wanted to do, it resonated with me to be a nurse. I'd heard from a friend here that's a nurse that they were recruiting for nurses to go. They needed them in New York. for the COVID-19 pandemic. And the moment I heard that, I wanted to go. I was drawn to it. A couple people ask, why are you doing this? You don't have to. And I just could not stop thinking about my mom. And, I grew up hearing stories about polio. I remember her talking about medical personnel, doctors, nurses, and she had one nurse in particular that changed everything for her and made things so much better for her. And because of that, I was given a pretty amazing mother and a pretty amazing life because of her. Sorry. And I thought, how could I pass this up to possibly return this to someone else? And so I went to New York City, and it was crazy. It was hectic. It was difficult, but it was so rewarding to have an opportunity to serve and in a situation that was affecting everyone that I knew, everyone in the world.
And the last voice we will hear from is Amanda Gorman, the youngest inaugural poet in U.S. history. This is an excerpt from her poem, The Hill We Climb, as read on January 20th, 2021. We will rebuild, reconcile, and recover, and every known nook of our nation and every corner called our country. Our people diverse and beautiful will emerge, battered and beautiful. When day comes, we step out of the shade, aflame and unafraid. The new dawn blooms as we free it, for there is always light. If only we're brave enough to see it, if only we're brave enough to be it.